Hi, this is Lupita, licensed marriage and family therapist, and this week I'm going to be introducing information that you want to know about child and adolescent depression. The idea that your child might have depression sounds very scary, but it's important to understand the signs of depression in adolescents and children because it might be slightly different than those of adult depression. This is one of the main reasons why it becomes undetected. It wasn't actually until the 1980s that the doctors began to recognize that childhood and adolescent depression was a huge issue. 1 in 20 children under the age of 19 suffer from depression at one point in their lives. Can you imagine? According to an article written for the American Family Physician Journal, risk factors for childhood and adolescent depression are family history of depression as well as low school performance. There are many other risk factors that have been seen in research. For instance, a recent death and loss, family divorce, substance abuse, experiencing bullying, abusive relationships, certain medications that you might be taking, family and friend conflicts, and other major events that happen in your life, such as moving away to college, maybe moving out for the first time from home, changing schools, moving away from home to a different city, just big changes that happen in a person's life. Now, similar to adults, children will experience a low interest in things that they previously enjoyed, maybe some low energy, some sadness, feelings of hopelessness, and even some tearfulness and crying. One of the things that's important to recognize in children and adolescents is that they also have other additional signs that may not be an immediate green light for assuming that your child is depressed. You might have additional signs that don't necessarily make you think of depression, and these signs may include frequent complaints of boredom, some low self-esteem or feelings of guilt, extreme sensitivity to rejection, and even extreme sensitivity to failure. You can see reckless behavior, and you can even see an increase in irritability or anger. Other people have noticed that there's frequent complaints of physical symptoms such as headaches or tummy aches, or frequent complaints of being tired all the time. And lastly, they might even talk about running away from home or have actually ran away from home, and they may even think of or talk about suicide. But because the kid or adolescent isn't necessarily sharing that they're feeling sad, parents or teachers may not assume that the troublesome behavior is associated with depression. But sometimes when you ask these children directly, they might actually respond to you and say that they're feeling unhappy or sad. Early diagnosis and treatment are essential for children experiencing depression. It can reduce the severity and duration as well as the functional impairments associated with the depressive episode. Depression is a real illness and it should be taken very seriously. Comprehensive treatment for children experiencing depression include both individual and family therapy. So if you, a sitter, a teacher, or anyone that spends a significant amount of time with your child, notice any sort of change in behavior or any behaviors that are listed previously, please feel free to contact us here at Peninsula Center for Children and Families. And make sure that you get your primary care physician also involved in the picture. And thanks for sticking around to this week's Fun Fact Friday. See you next week.